What's up, everyone? Happy 2021. Welcome back to another episode of Bombshell1111 Podcast, Therapy for Women of Color. My name is Keya, and I'm your host. On tonight's episode, you guys, we have a guest by the name of Tamara Houston. She's a clinical social worker and owner of a group practice and consulting company. In her practice, she focuses on trauma, anxiety, grief, and bereavement. Right after this short commercial break, we'll be right back to jump into that episode. So you guys, without further ado, let's get to it. If you haven't heard about Anchor, it's the easiest way to make a podcast. Let me explain. It's free. There's creation tools that allow you to record and edit your podcast right from your phone or computer. Anchor will distribute your podcast for you so it can be heard on Spotify, Apple Podcasts, and many more. You can make money from your podcast with no minimum listenership. It's everything you need to make a podcast in one place. Download the free Anchor app or go to anchor.fm to get started. So the Bombshell 1111 Podcast, Therapy for Women of Color. My name is Keya, and I'm your host. Tonight, you guys, is my very first episode for the 2021 year. And it is a very, 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 to me, special episode because it's going to talk about and focus on topics that we tend to shy away from, but definitely need more knowledge upon. And tonight, you guys, I have a very special guest by the name of Tamara Houston. She's a clinical social worker and an owner of a group practice and consulting company. In her practice, she focuses on anxiety, trauma, and grief and bereavement. So without further ado, let's welcome her to the podcast, you guys.
Thank you for having me.
You're so welcome. Thank you so much, Tamara, for coming on and being a part of the podcast. Again, as we spoke before, I told you I think the practice that you have and the things that you consult in, especially the anxiety, depression, and bereavement, that's something that definitely needs to be more educated on within the Black community, because I say that when we deal with death, and that's just from my personal experience, within the Black families, we tend to deal with them differently. And most of the time is anger, and anger directed at the wrong person. And sometimes it also goes into depression, in which you also touch on, which may also lead to anxiety. So I think, you just have a rainbow of tools that are needed, not only just for the African American community, but for the community in all. So again, thank you again for coming on.
I appreciate it you having me on. So I absolutely agree with what you're saying. I really enjoy having the opportunity to do talks like this, because just like you're saying, these conversations don't really happen too often in our communities. I mean, I think conversations around mental health, period, have become more of the norm. So we're moving in the right direction. But there are definitely some demographics that are kind of behind the bar in that. So I enjoy having an opportunity to share, get information out there so people know exactly what they're dealing with and just have a touch point. So, I mean, whether you're reading a book or you're listening to a podcast, it's better that you have the right information than have no information at all.
Oh, yeah, you said it there. So without further ado, let's just go ahead and jump in. So a lot of people say they have anxiety just because, like you and I kind of discussed earlier before, they've heard someone else say, I'm having an anxiety attack, or just because they've seen it on television and thinking that may be what they're going through. For those individuals who don't know, can you kind of break down what are the 5 most common types of anxiety disorders?
Of course. First, let me just in thinking about what anxiety is in general, it's an overactivation of our system. If you hear nothing else that I'm saying about anxiety, if you think about fight or flight, and oftentimes, this is a more familiar term. It's something that we all experience in a way, because when we are presented with danger, right, our system automatically goes into this state of protection. It is built to preserve life. And it's not asking us questions. Hey, do you want me to run, or do you want me to fight, or do I freeze? That's one of them too. So it's not asking our permission. It just automatically does what it needs to do. However, with anxiety, it's like an overactivation of those that internal mechanism. So the primary ones are going to be generalized anxiety disorder, and that is characterized by chronic anxiety. So it's like a constant worry, even about little things. And like the catalyst for that is often unknown. Some people, especially I'll just talk about my clients that I work with, often have a hard time trying to like pinpoint where it all started, or even sometimes when it started. They may be able to see, like, I remember being nervous, when I was in the 5th grade, and it kind of going on from there. But like actually having an exact start of it is hard to tell. So really and truly, the generalized anxiety, the key word is there, is generalized. You just kind of worry about any and everything. I refer to that term as like the worry ward, right? So no cause, just kind of worrying about a lot of stuff. Then you have panic disorder. I think would probably be the next one that I see quite often in my office. And I would add to that agoraphobia as well. So we use a big book called the DSM, and in that book now, panic disorder and agoraphobia are separated, but it is basically characterized by having like moments of fear accompanied by some other symptoms, but it just kind of happens like quite suddenly. And those symptoms may be a lot of people will say like their heart is racing, or they feel short of breath. Some people feel nauseous. Things that you'll hear them say often is like, I felt like I was going to pass out. There may be some abdominal stress, like abdominal upset at that time. So the panic disorder is just like a really intense kind of fear that comes on quite suddenly. The agoraphobia part is you have some of that same kind of definition of that, but it applies to like going out into spaces. I wish I could remember, as I'm saying this, I remember a movie about this lady that would not go out of her apartment, and there was like a serial killer or whatever, but every time she would open up the door, she would just get really dizzy. Like she could not go out into these closed spaces or being in enclosed spaces. So either way, so far, generalized anxiety disorder and panic disorder. Then you have obsessive compulsive disorder, and I think this is one that we often will mislabel anyway. But it's an anxiety disorder. It's characterized by two things. You have pretty frequent, like unwanted thoughts. Like, so these are the obsessions, and this is coupled with repetitive behaviors, which is the compulsions. So a person may wash their hands quite frequently. They may have to, I tell you, I do this a lot. Like if I leave the house and I will get up to the stop sign, I'm like, did I turn the stove off? And I have to go back. Like I have to actually see that I cut the stove off or that I turned the iron off. But it can be the extreme of that, where some people have to like touch a door or do something to a piece of clothing or tap so many times. That is obsessive compulsive disorder. And so it is anxiety written as well, because what it increases anxiety. So what happens is when these like rituals are not able to be performed, a person may notice that their anxiety level will increase. So another one is going to be like social anxiety. So it's, again, the same kind of like idea around general anxiety, but it's related to being in social settings. So that's like the precipitating factor, someone being in a social situation. So that would be one. And then this actually falls in a different category now in the DSM, but it used to be, I think, maybe in 3 or 4, but it's post-traumatic stress disorder, or PTSD. And this is, it has a lot of the same characteristics of anxiety disorder that develop after exposure to an event or situation where there was physical harm, or physical harm was threatened. So I normally put this in the category of like big T and little t traumas. Like those big T traumas are going to be, an example would be like military experience, combat, wartime experience. And then like that small T trauma may be like a car accident or something. I shared before we got on of my experience with anxiety, and I had a little T trauma in a car accident. Nobody was hurt. But I definitely in that moment felt this like disassociation, like I was just hovering over watching everything that happened. And from there, that led to a number of symptoms that I would experience every time I got into my vehicle. And it took me about a year to kind of resolve that and get to a place where I could manage the anxiety that came up with me driving. And so, just to review, you have generalized anxiety. We also we use a lot of acronyms, I guess. So that's GAD, panic disorder or agoraphobia, obsessive compulsive disorder, OCD, social phobia or social anxiety disorder, and also post-traumatic stress disorder or PTSD.
Okay, thank you so much for that, Tamara. Just to go back to the OCD, obsessive compulsive disorder, you are absolutely correct, because I'll share personally as well. I have to come back when I leave to check to make sure I lock the door. I have to come back. I can be far away. Literally, sometimes I can be go to work and think about it and say, I got to go back and check. And I think it has something to do with me being traumatized with someone trying to break in on me before at night. And since then, I can't sleep by the door. I have to sleep on the opposite side of the bed from the door. And then I have to continuously come back and check the door when I leave. So, yeah, you are absolutely correct.
Absolutely.
After getting educated on those different anxiety disorders, how does an individual get diagnosed with that, with those particular disorders, and what are the risk factors for those anxiety disorders?
Okay, absolutely. So I will say this is a really generalized question, actually, because I think this will pertain to any mental health concern, whether that is in the DSM or not. Is it all starts with an evaluation, and depending on the provider that you go see, you want to make sure that you are working with someone that has some training or specialization around issues concerning anxiety. Okay. I am a clinician, so I'm a clinical social worker. However, I will not downplay the impact of any other healthcare professional in terms of how they can assess and help with these particular issues. So I do want to say that first, but you want to make sure that the person has some training and expertise around anxiety disorder so that they know exactly what it is that they're looking for. But it all starts with that evaluation. It could be called whatever, a mental health evaluation, a psychosocial evaluation, or whatever. But within this evaluation, you are going to be, as a client, being asked a lot of questions and really just sharing kind of the history of your life, really. And it could be around a particular issues, or if you feel or know that the anxiety has or whatever it is that you're feeling, because you may not know that it's anxiety. So whatever it is that you're experiencing, you may, start whenever that was, if that was fifth grade, if that was 2 years ago because something, happened, whenever that was, and just kind of share what your experience has been around that. So you're looking at all the different parts, how you behave, how this experience is showing up and how you react to that, your feelings and your thoughts around that. This is going to give that provider the information that they need to determine whether or not you meet the criteria as set forth in the DSM. One of the tools that I use is called a GAD-7, and it's just a measure. It's kind of like a survey, and it's one that a client can complete on their own. Oftentimes I will complete that in the office with them on that initial evaluation. And it has like 7 questions on the GAD-7, so it has 7 items on there. And you ask a statement, and the client gets to rate what their experience has been over that from, I think, a 0 to 3. And depending on what the number is, it will give an indication as to what level of anxiety that client may be dealing with, if it's mild, moderate, or severe. So it's not diagnostic. It's not, if someone gets 21, that doesn't, I'm not going to look at that and say, okay, yeah, you got anxiety. I'm also getting the other information that I received from the evaluation. So some of that is going to, again, it's going to be how you're thinking, your behavior, your feelings, your family history, because what we know about mental health is there's that biological component as well. Are there other family members that you are aware of that have experienced the same thing or have a diagnosis of one of these anxiety disorders? And then all of that provider is going to go back. So I'm specifically talking about therapists. That provider is going to go back and compare that to the symptoms that are indicated in the DSM. And what some of those are going to be is like uncontrollable worry and nervousness, trouble sleeping, inability to concentrate, irritability, restlessness, heart palpitations. As with any mental health concern in the DSM, all have to meet this criteria that whatever it is and how many of us meet, it has to be disruptive in your life. So there has to be other implications outside of you just experiencing the symptoms. It has to disrupt your life socially, vocationally, in those areas. So there has to also be some type of disruption. And like an example of that is working with a client that, they're late to work every day because they have an anxiety attack or panic attack whenever they get in the car. So it's not that they are intentionally trying to be chronically late, but their, work productivity, their ability to get to work on time is being impaired by the fact that they are having these symptoms related to anxiety. So there has to be some implications in your life that you can provide an example of. And then some of the risk factors are going to be things like, let me say this. Sometimes these mental health disorders and anxiety, and we'll talk about depression too, can be caused by other mental health disorders, right? So some of the risk factors are going to be if there's substance abuse involved. That is can definitely be a cause of that. If there's withdrawal from substances or continued use of alcohol and drug abuse, that can lead to anxiety disorders. Experiencing trauma, whether that's a child or adulthood trauma, can be a precipitating factor. Having I'll say an overabundance of stress in your life. And I say overabundance because stress is not a thing that we can avoid. I would love to have a stress-free life, but the truth is there's good stress and there's bad stress. So we can have a lot of good things happening in our lives that can feel as heavy as some of the bad stressors that can take place in our lives as well. Family members. So people who have family members with anxiety disorders are at a higher risk of developing it themselves. And again, that's that biological component of that. And there's, research and different statistics around like personality, character traits that may be more prone to having an anxiety disorder. For example, a person that's more introverted, that may be because they tend to keep to themselves a little bit more. Maybe they're a little bit more isolated. While that's could be intentional or not, like you're just one to just kind of keep to yourself a little bit more. So there may be things that you are that you're dealing with or experiencing that you're not really speaking on or sharing with other people, because your personalities that you kind of tend to keep to yourself anyway. And also being female, unfortunately, their statistics show that anxiety disorders are most common, more commonly occur in women, and that tends to be a lot of the research around depression as well, that females tend to end up on that end. And there's psychosocial and biological components to that, the reason why that would be the case. And then there can be other issues like actual physical issues that we're dealing with that we don't, and this is one of the things from my practice that I talk to clients about all the time. One of my assessment questions is do you have a primary care provider? When's the last time you had a checkup and got blood work done? Because there could be things that we are missing, like nutritionally, vitamins, things that are impacting us that are showing up to mimic mental health disorders, but it could be that we're deficient in some of those nutritional and vitamin areas. So that could be one thing. So heart disease, thyroid issues, irritable bowel syndrome could be a problem. That person is constantly saying they just feel nauseous, their stomach is, tore up, all the time. That's with the ideas that you need to get a handle on that. Gut health is super important when it comes to us being able to manage our overall wellness anyway. So these are things that are preventative in a way that if we could be more proactive in getting these type of things done, we might be able to head off some of the anxiety that may not be organic in nature because it's not biological perhaps, or this huge stressor or trauma that we've experienced, but just that we're kind of dealing with a lot of stresses and stuff. If we were to be more proactive in those areas, we may be able to head off or kind of lessen the intensity of some of the symptoms that we may experience with anxiety.
So to kind of segue into our next topic, but before we end with anxiety, Tamara, can you give us a couple of treatments that are common treatments that are available for people who have anxiety disorder?
The most common is going to be psychotherapy, which is therapy, and medication. And honestly, I get probably just as many clients saying that they don't want to try medications as I do those clients that are saying that they do. What I always recommend is, especially pharmaceuticals is not my area. So this would be an area that I would refer out to, as I'm recommending to a client, is just to talk to their doctor about it so that they can know what their options are, right? So you may have this idea that your cousin Frank was on this medication and they got addicted or whatever, but you don't know what all was going on with your cousin, whether that was internal or external, that may have impacted such an outcome. What you need is individualized care to make the most informed decision for yourself. So speaking with your primary care provider about your medication options is going to be helpful. And then therapy is going to be helpful as well. The most common one is going to be cognitive behavior therapy, but there is a ton of other types of therapy modalities that are going to be useful depending upon the specialization of the provider that you see. I also would not discount very practical things that you can do, like meditation, yoga. Just practicing a simple breathing exercise is going to be great. One of the things that I do in between my sessions, or just when I'm transitioning out of, I'm working to going into helping my children or whatever, because I have two virtual kids at home, is just practicing some type of grounding technique where I'm just kind of being mindful in the moment and getting connected with the ground. And that may look like, if I'm sitting here at my desk like I am now, putting my feet on the floor and just kind of thinking about, what does that feel like? Do I feel connected to where like I can stand up and feel supported? Do I feel supported in my chair? Perhaps I have been sitting and I've kind of been slumped over because I'm tired. I need to sit back and feel the back of that chair on my back. So those are like really simple things. The breathing exercise is going to be something as simple as taking 3, inhaling for 3, hold for 3, exhale for 3. You can Google that and find a ton of different combinations of like breathing exercises that you can do. But all in all, as I said in the beginning around anxiety, it's an overactivation of that internal mechanism that controls fight, flight, or freeze. So what you want to do, it helps to bring in what we need to help to slow that system down and get us back down to a calm base so that we can make a decision about, okay, well, are we really in danger, or is this a stressor that I need to deal with right now? Can I put this on the back burner? So those are some practical things, but ultimately the research is showing that psychotherapy and medication is going to be the most successful treatment. But again, I've had clients that for sure I have recommended them for yoga and meditation and a number of different like somatic skills and stuff to try to help to alleviate some of that that anxiety that they are experiencing, and they have reported that it has worked well for them.
So thank you so much for that, Tamara. So let's jump into our next topic for tonight, which is depression. A lot of people suffer from depression, whether they speak about it or not, for different reasons. I wanted to have an opportunity for you to kind of talk about that a little bit more, especially as it revolves around bereavement and, going through death. For those individuals who may have lost a loved one, and how to properly heal from that and how to deal with that. But before you go into that, I wanted the audience to have an understanding of exactly what is depression and the signs and symptoms of depression.
So I appreciate you asking the question as it relates to grief, because this is a one of those areas that we are often miseducated in. And so the first thing I'll do is answer your question, like what is depression? So typically when we use depression as like just a lay term, but oftentimes when we are referring to depression as clinical depression or major depressive disorder is what we're talking about. And this is typically where a person like feels just like in a constant state of sadness or like a lack of interest in life. So it could be one or the other. And it normally happens in what we call episodes. So those episodes can last for, sometimes they can happen quite frequently, meaning like you can really feel an intense sadness for a while, and then you can come out of that. Another piece of that is sometimes we can have like a phenomenon called double depression, where a person can also have persistent depressive disorder, or it's also called dysthymia, where it's just like your overall day is just kind of like gray. It may be that person that tends to see the life as like just a glass half empty all the time, just blah, And so that type of depression tends to, you have to have the symptoms related to that, which are very similar to what you may experience in just normal depression over a 2-year period. But major depression happens in episodes. So it can last some days to a couple of weeks, like I said. And it's just that general sadness. Some other things that you may also experience is feeling tired, a lack of energy almost every day, not feeling worthy, feeling guilty about whatever. There can be a huge disruption when it comes to sleep. You may not sleep at all, or you may sleep too much. This may happen every day. You may have bouts of that. Appetite can be impacted as well, where you may eat more than you should, and other times you may not eat enough. And so there can be a vacillation in those types of experiences, feeling cranky and restlessness, having a headache. You can also feel anxious. And this is the reason why having that evaluation is so important, because I often hear, and I've mentioned this offline too, about how we misuse the diagnosis of bipolar disorder. Sometimes a person can be experiencing anxiety and depression, but they're being labeled as being someone who has bipolar depression, and that may not be the case. So this is why that evaluation is key to making sure that you get the proper diagnosis. Because when you talk about depression, you have several different types of depression. Just like we talked about anxiety, there are several different types of anxiety that a person can experience as well. So those are some of the things. Ultimately, the main thing that you're looking for is just like this general sadness. Oftentimes, there's also going to be a possibility of having thoughts around death or suicide, and not just like you either that being an act that you engage in yourself, but it could also be like just a fear of death as well. So there are a lot of different things that we will look for when it comes to depression outside of sadness as well. And again, as I said with anxiety, it's that same piece about there also has to be a disruption in your just daily functioning, right? So problem at work, problem socially, like in your relationships or something, you would need to be able to state how this is impacting you in other ways, instead of just saying, okay, I'm experiencing these particular symptoms. And oftentimes, you could be operating in that state for so long, it may not be an awareness that you have. And so working with a professional can kind of help you to put those pieces together that, okay, well, if you were not experiencing these symptoms, or if you were able to get this under control, how could that improve your relationship, or how could that improve things at work? So that would be one thing. Now, leading into grief, okay, dealing with grief and bereavement, one of the things that we need to know out the gate is there is a difference between the depression, the clinical depression that you experience with like major depression, bipolar disorder, persistent depressive disorder. There's a difference between those types of depression and the depression that you experience with grief. And I'm just going to run through a couple of things here. So with grief, there is an identifiable loss. So there was a person that is no longer there, and people use different terms for that. They could, be pretty vague about it, like I just said, or death, or transition, or whatever. But there is an identifiable loss. It may not be a person. It could be a loss of anything. You could have lost your job. You could have lost a relationship. It could be a number of different things, but there's an identifiable loss, where with depression, a specific loss may or may not be identified. Like, you may not develop depression just because, you had to transition in a job, or because of the relationship. So you could experience both, but it doesn't necessarily mean that you're going to develop clinical depression because there is an identifiable loss. So that may or may not be the case. In grief, the person's focus is on the loss. So going back to what I said about anxiety, like oftentimes we cannot identify a specific trigger. With the depression that you experience in grief, you can identify this thing happened, and this is the result of me feeling, thinking, being this way. Where in depression, clinical depression, the person's focus is on self. It's just on them and what their experience is, not something, I no longer have this, and so therefore I'm depressed. That focus is more so on them. There can be fluctuating physical symptoms with grief. In depression, there's prolonged and marked functional impairment. So in grief, like, you may, have days where you're feeling really great, and and it could literally be a day. This day you're feeling really great. The next day something hits you, you have a memory or something, and it just kind of fluctuates like that. In depression, it's going to be a more prolonged and more visible, like observable functional impairment. With grief, there's you're able to feel a wide range of emotions. Oftentimes, when we talk about grief, and this is because a lot of the research, there's a lot of stages and cycles and tasks and stuff, and all of those things are true in their own right. We just need to have more education around how to interpret those stages and phases and all that stuff as it relates to our own grief. However, what grief really looks like is, if you can think about like a child, you ask a 3 or 4 year old to draw a picture, and unless they are like really like creatively inclined or something, their picture is going to look like maybe a bunch of scribble scrabble. You know what I'm saying? And then they bring it to you and they're like, oh, look at what I did. And you're like, yay, what is that? Oh, that's a dinosaur, right? But it looks nothing like a dinosaur. It just looks like a bunch of squiggly lines. That's what our grief looks like. It's just all over the place. Where depression are more fixed emotions, and there's a feeling of being stuck. And I hear this all the time. The client's report is, I just don't want to feel this way anymore. Well, what is this way? And oftentimes they can say what this way is. It may be different for individual people, but they can pretty much specify that there's a stuckness. There's something about that's going on with them mentally and emotionally that they just don't like. Where someone dealing with grief, there's just a hodgepodge of emotions that are just all over the place. With grief, their thoughts of death are typically related to wanting to be reunited with the deceased loved one. And that could be like in that area of bargaining, like, why not me? Or, if only I could be with them, if only I could see them again. Well, the only way that's going to happen is, and if you have certain beliefs around that, is if you are also no longer here. So that may encompass your thoughts around death as it relates to grief. Where in depression, the thoughts of death are related to feeling worthless, undeserving of life, or unable to cope with pain. So that's really important. I want to offer this. There is a really nice chart that covers this information that I just shared. If you go to betterhelp.com, there's an article on there about suffering from depression. So I'm always really clear not to take any credit for someone else's work. So I'm actually reading this particular piece of information from a chart, but it is absolutely true. With grief, things are just going to kind of be all over the place. It's not as static as a person is going to experience with depression.
Wow. Thank you so much for that. That was very useful, like I assumed and knew that it would be. And I know that the listeners will definitely take that information, and hopefully they'll use that information. Lastly, to close us out, Tamara, what are some treatments that you foresee or that you currently use to deal with depression?
So I recently became certified. Actually, I just got my certification notification yesterday in EMDR, and EMDR stands for EMDR stands for eye movement desensitization and reprocessing, and it's a form of psychotherapy, and it was developed by Francine Shapiro back in the 80s. And she did a lot of this work around, it started out with just working around distressing like images. And what I really like and appreciate about this work is a couple of things. For me as a clinician, it really lightens the load for me, because what you are working with is the body. What she talks about and what I really believe is that the body has everything it needs to heal itself. Now, sometimes we have to clear some things out in order for it to do the work that we need it to do naturally. And that is really what EMDR helps to do. It helps to clear out some of those pathways so that people are able to heal from symptoms and emotional distress that are a result of just disturbing life experiences. And in the training that I've done, I've heard stories of people actually healing from trauma that has impacted their life as adults and shown up in as depression and anxiety and other things. Substance abuse has shown up as other things, but this trauma happened in the womb. And so I am just like super excited about my journey with this particular work. And what it mimics is it mimics what happens when a person, when we sleep. Our bodies, if you've ever watched anybody sleep, right, you may notice that their eyes, whether they are, it kind of scares me a little bit when I see people sleeping with their eyes open a little bit, but some people do that. But you'll notice that even if their eyelids are closed, that their eyes are moving really quickly. They're moving around really quickly. And it is during that process, it's called bilateral stimulation. It is during that process that the body is repairing itself from all of the things that have happened during the day, and maybe some, things that have happened throughout the week or even before then. It is actually doing the work to repair itself. And so this is why sleep is so important to our overall wellness, because there's work that our body is doing. Like, it's not shutting down, it's actually going to work. So during the day, we may get up at 8 o'clock, you know what I mean, and start getting ready for our day to go to work. But then it's at nighttime when it's time for rest, or whatever your wake sleep cycle looks like. It's during your rest time that we go into REM sleep, which is called rapid eye movement sleep, that your body is saying, okay, you went to work today, you did your thing, now I get to do my thing, and kind of clear some of this stuff off so that when you get up the next day, you will feel rested and you'll have the energy to go out and do whatever again. So that's one thing. There's some great work around internal family systems. That's called IFS. That's another type of psychotherapy that's out. I'm really liking this really, I think, a huge movement around yoga. Over the summer, I think it was summertime, it may have been late spring, that there was an organization that was giving out scholarships for African American women to actually complete a yoga certification. And you had, so many months to actually get it completed and then get some other additional type of certification. But for those that got the opportunity to get that certification, I believe you have until December of this year to complete that. And so there is a lot to be said about the work around yoga and meditation, and just being in spaces where you can be mindful. I think creative therapies are going to be helpful as well. Some people just don't have the words, right, to describe what their experiences are, or to say I'm feeling this way, or this is what I've been thinking. Some people are just more creative beings, and they need an opportunity to express themselves in a different way. I think about, I have 3 children, and my middle child, she just learns differently. That's the bottom line. She just learns differently. Mm-hmm. And so if it's music, going, she could be in class, but if she got music going, she is picking up stuff like boom, 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 boom. I remember when she was taking piano lessons, like her math grade improved when she was taking piano lessons. And there's a lot of research around why that is the case. But some people just learn differently. They're able to retain information differently, and be able to express themselves differently. So I think the therapies around like creative arts are really showing up more in this area as well, around depression and anxiety. So that's your music, your movement, your art. All of those therapies are really making some headway. I know there are some things going on with different types of medications as well. What I would suggest, just as another tip for people that are, either concerned about or interested in trying to figure out what medications are going to work best for their bodies, is to follow up with your primary care physician and ask if you can have a gene site test done. Gene site test. And some, you know, providers don't like to do it, you know, for whatever reason. I'm not a medical doctor, so I don't completely know all the reasons around that. I can only share what has happened with my clients that I've referred to. I had clients that were taking medications and they just were not, they just weren't really effective, or had some efficacy, and then at some point just didn't seem to be working as well. That GeneSight test gives you information to help you determine what it determines really what medications, what they're called psychotropic medications. So the medications for depression and anxiety are called psychotropic medications, and it helps to determine which of those medications your body metabolizes best. So it's a very short test, not, you know, very expensive. I'm not sure if insurance is covering it now. I remember one of my clients from years ago took it, and it was like $20-something for her out of pocket because the insurance didn't cover it at that time. But that was probably about 5-6 years ago. So I'm not sure how that works now, but that is definitely a tip for people to consider, to see what's out there around medications that may be helpful to help to manage some of this depression and anxiety that we're dealing with right now.
So the last thing, Tamara, for those individuals who may want to contact you, you know, to reach out for you for services, can you let the listeners know how to contact you on your social media
Absolutely.
platforms?
Probably one of the best ways to get into contact with me is going to be to visit our website. Our website is www.renewal, that's RENEWAL, life, LIFE, counseling. So Renewal Life Counseling. On there, you'll find information about all the providers, the insurances that we accept, the particular specialties that we have. And on the last page, the Contact Us page, is where you can send an email, and that will come directly to me. Even if you're trying to reach another provider in the office, all of those emails come directly to me. So I would get that and be able to follow up with you that way. And I will say, even if it's just from hearing this podcast, if you just have a question about, like, where do I start? I have the page is actually called that starting point. So it gives tips about where, in this process of either finding a clinician, you know, whatever services that you need, what questions you need to ask, what you need to do around checking your insurance and stuff. It is the top of the year, so you want to make sure that you know what mental health benefits are covered there. So that's going to be the best way, is to reach out to me via that website. But I'm also on Facebook. Renewal Life Counseling is there, and it's at Renewal Life Counseling. There's some additional pages attached to that. I have Healing Bloom, which is our podcast around grief and bereavement. And you can actually just search that out. There's a community, and there's also a page that you can follow. So it's a new podcast, but it's really just about sharing stories around grief and bereavement, and just normalizing the conversation around death. And it's not just death of a person, it's just death in general of a lot of things that we are experiencing. So that I'm on Instagram. Instagram is at Renewal Life _RLC. On Twitter is at Renewal _Life LLC. So feel free to reach out to me on any of those. And then also Houston Consulting, that is a business. As a consultant, I'm really niche down. So I primarily work with female entrepreneurs that are in private practice. So if that is an area that you are interested in, I have separate contacts for those, but you're still welcome to reach out to me via those platforms that I just mentioned. And also my email is info@renewallifecounseling.com. So if you don't remember Renewal Life Counseling, then you can Google as well and find information through Google if you need to. You can just Google Renewal Life Counseling.
Well, thank you so much, Tamara, for coming on and sharing your resources and your knowledge with us tonight. I'm knowing that the information you shared was powerful and as well as useful to the listeners, because I learned a lot as well. So again, thank you so much for coming on. So you guys, with that being said, we're going to end tonight's episode. Always remember, you are a bomb within your own shell. Peace, love, and light, you guys. Good night. If you enjoyed this podcast, please make sure you subscribe so you're notified when a new episode is posted, rate, review, and share this podcast with your family and friends. Thanks so much for listening, and I hope you're leaving with some valuable information that can help you on your personal journey. Also, check us out on Facebook, YouTube, and Instagram at Bombshell1111 or at Bombshell1111 TV. You can also check out our mental health page, Your Health is Your Wealth, on Facebook, which is a page created to inform and support individuals with mental health and other health conditions. And with that being said, always remember, you guys, you are a bomb within your own shell. And until next time, peace, love, and light.